Hi everyone, this is Dr. Dev. I'm a Chief Medical Oncologist and Hemato-Oncologist working at Medicover Cancer Institute, Visakhapatnam. Today we are going to talk about blood cancer. Whenever we talk about blood cancer, we always get the picture of movies where people would be coughing out blood in the hands. No, that's not true often. No, sometimes it can happen, but that is not what exactly happens in blood cancer. So blood cancer, as we know that if it is called leukemia in technical terms. So there are different types of blood cancers. Like most often these blood cancers happen in the children, like younger age. But even in adults, blood cancer can happen. So essentially, there are two types of leukemias or blood cancers. One is acute lymphoblastic lymphoma or leukemia. The other one is the acute myeloid leukemia. So these are acute leukemias. There are something called chronic leukemias. Chronic leukemias like CLL, chronic lymphocytic leukemia, or chronic myeloid leukemia. These are all slow-growing leukemias or slow-growing blood cancers. We don't even call them, the blood cancer. We call this slow-growing tumors. But in contrary to slow-growing, acute leukemias or acute blood cancer are very serious. And here the blood counts can go up to 5 lakhs or 6 lakhs, or the blood counts, the TLC can come down to 1050s, and they'll invariably will have low platelet count. Platelet count can be 3000, 5000, 10,000, sometimes very severe low platelets. Because of low platelets, people often come with bleeding. The bleeding can happen in the form of menstrual cycles, increased menstrual bleeding, bleeding in the urine, or whenever they cough, they can have blood in the sputum, or whenever they cough, they can have bleeding in the internal bleeding in the lungs. So just because of the low platelets, because of the cancers, they can have low bleeding. So what exactly is this leukemia and how does this happen? So we don't know the reason why leukemia happens, but often it is predicted that exposure to chemicals or developmental anomalies. During the development, we don't know what exactly goes through, and most often it's idiopathic, and its hereditary transfer is very, very minimal. But one thing is that whenever people develop leukemias in the later age, probably chemical exposure is one which can cause blood cancers. Like especially benzene or chemical factories, people are working in the chemical factories are more prone for developing blood cancers. So whenever somebody develops blood cancer, the most important sign and symptom is that weakness, because hemoglobin is so low that people have very severe weakness. And because of low platelets, they can have a bleeding. And because of TLC, which is not normal WBC, they're all blast or cancer cells. Because of that, the immunity is very, very low. So they often tend to catch up with infections very often. Like they could have pneumonia, they could have recurrent UTIs, they could have recurrent URTIs, and etc. So, and fever is another symptom. If somebody has persistent fever or any of these symptoms, we need to check. And if somebody has some atypical cells in the blood, if you come to us, then we'll do a bone marrow, we'll run some of other tests like flow cytometry, molecular genetics, etc. and etc. Then we would determine what type of blood cancer you have, and depending upon the blood cancer, we can go for treatment. So another common question which I get is that, what is the stage of blood cancer? So unfortunately, we don't use the staging system like for breast cancer or lung cancer. We have stage 1 to 4, but in blood cancer we don't have those stages. But in blood cancer we have something called the risk, whether the patient has standard risk or whether the patient has intermediate risk or high risk. So this classification is very, very important, because those patients who fall in the high risk category need to be consolidated with bone marrow transplantation, especially allogenic bone marrow transplantation. But if the patient is in the standard risk, we don't need bone marrow transplantation. So the classification of blood cancer into standard risk and high risk is very, very important. And that classification is done by various clinical factors as well as molecular factors, that is genetic factors which we send. And based upon that, the treatment again, depends. So we can, for AML, the treatment usual duration is 6 months. For ALL, the usual treatment is for almost 2.5 years to 3 years. So the treatment would vary again depending upon the type of AML, type of ALL which we get, and age of the patient, and etc. and etc. Thank you.